I'm Mike James, I'm a consultant urologist. I work at Chesterfield Royal Hospital in North Derbyshire. My only real personal involvement has been to attend the first of the Nottingham events a few months ago, but it's obviously something which is a hot topic for conversation at all levels in the health service at the moment. Going in with an open mind but with enthusiasm and just waiting to see what the day brings, really.
My name's Anne Carter. I come from Newark in Nottinghamshire. I'm recently retired after 35 years in retail. I attended the first event in September, which I found very useful. I quite recently had a foot operation, so I was able to give my feedback to that. So I've got a very open mind. I'm hoping to hear a lot of feedback from our ideas that we put in last time and see what they're going to do.
Welcome to everybody. There's more than 1,000 people taking part in today's debate around the country. But the purpose of today is to really help the government and the Strategic Health Authority to shape plans for the future of all of our NHS. So it's a big event. We have 9 events happening today. So going around the country, and you'll see other people in rooms similar to this. But without further ado, what I'd really like to do is to welcome Professor Lord Aradazi.
Thank you very much. Well, firstly, thank you all for taking the time again to be with us. The whole purpose of this review is to engage with the patients, the public and the staff within the NHS in designing where the NHS is heading over the next 10 years. It is an engagement between the clinical staff and other staff who work in the NHS locally with the users and the public locally. That is very different than any other review we've ever seen actually in the history of the NHS. I'm going to introduce you now to the Secretary of State, Alan Johnson.
How can we celebrate the 60th anniversary of the NHS in a tangible way that means that the public, patients and staff have been involved in setting the course for the next 10 years and beyond? I'm enormously grateful for your contribution. This is not an easy task, and there'll be lots of questions and lots of responses you'll need to give, but it's a very valuable way to ensure that we end up with the kind of NHS that we want to see, in which the public, patients and staff really feel they've had a role in shaping. Have a good day.
Being in Nottingham today, may I introduce to you the chair of the chairs in this part of the world, and that's Dr. Lakhani.
Things are good in the NHS. Overall, people are quite satisfied, but there's still a fairly substantial minority who want to see further improvements. So in response to these concerns that you expressed, the interim report was published by Lord Darzi. It talked about things like ambition, wanting the very best instead of minimum standards. It's exciting because we can focus on the things that matter to you, which actually are the things that matter to clinicians as well. So thank you very much.
Thank you very much, Maya, and thank you, Ara. We're going to go to your tables for the first discussion session in a minute.
Anything else that came out of that presentation then?
I think actually the fact that they are aware that they do need to get more services locally.
It's about the cleanliness thing. I mean, I had a friend that was in hospital for a good 7 months in a coma, and he contracted MRSA. Do you know what I mean?
I think the service is very much improved. My only problem is getting the appointment in the first place. Once you've got that far, the doctors are fantastic.
There are lots of staff who want things to change and who are frustrated, and I think they've had a lot of initiatives and they've got ideas of their own.
I don't think at that age that they don't always question, they just go along with what people say, go here, go there. You know, they don't always stand up for themselves and say, I want it doing quicker, do they?
Do you feel the things you just heard talked about address the main issues that you're concerned about?
I mean, I think it's a very positive thing that, you know, things like this are happening and they want to know what people are thinking and what ideas people have about it.
How do you feel about what you've heard? Is it addressing the concerns that should be?
I mean, it's good. I mean, I think we've been doing some of this already, though. We're not, as professionals, trying to stand still. We're trying to improve things.
It's reassuring that this has a much more local focus, because I think one of the worries about big national initiatives is how they'll sort of translate into your local needs.
Perhaps what's missing is the interface with local governments, local authorities. It's still quite health focused and not enough focused around the totality of public services.
It will be much more routine for patients as they're approaching the terminal stage of an illness to be asked what their preferences are about things like resuscitation and what they want to happen to them when they become so ill that they can no longer make those decisions.
But that's been a really, really interesting and lively conversation. So thank you all very much. And we're now, I think, connected with everybody else around England. So first of all, I'd like to go over to you in Bury St Edmunds.
Thanks, Vicky. There are some things here, I think, in the east of England that are seen as really fundamental, and one of those is the importance of patient-centred care, with 83% of people here saying that it's very important.
Over to you, Tunbridge.
Hi, Vicky. We're having a good time down here, as you can hear. A particularly strong message about education on mental health, I think perceived here to be an issue that isn't talked about very much.
Let's see what's going on in the southwest now and go over to you in Bridgewater.
We absolutely believe that it's very important that the NHS treats me as a person, not as a symptom.
It's gone fantastically well. I mean, if you just see the amount of energy here, the amount of enthusiasm of the engagement between the patients sitting around, the public, and also the staff who've been, sharing some of these hopes. In June, July, around the 60th birthday of the NHS, we'll come up with the tools that they need to make this vision into a reality. Tremendous optimism. The more you come to these things, the more optimistic you become.
It's interesting, just the whole experience is interesting and therefore certainly worthwhile on a personal level. As an event, I'd give it, in terms of marks out of 10, probably an 8 out of 10.
I've had an excellent day, actually. I've learned a lot of new things that they're going to do. I like the idea that they're going to alter the pathways to care, coordinate clinicians and different people so that patients don't have to have such a long wait. It's nice to give our input because obviously under normal circumstances we wouldn't be able to do that. Yes, overall I think it's been a great success, yes.